Okay, thank you very much for that introduction, Linda. So I'm going to talk today about some recent research, but particularly thinking about the impact of research into heritage and well-being, in order to think about how close this is bringing us to the sort of tipping point where we can really make a step change in the sort of extent of engagement and get beyond perhaps the believers. All of us in this room, I'm sure, believe in the relationship between heritage and well-being. How we can really sort of shift the dial much more widely, both in terms of availability of activity, of funding, and of sort of public engagement with the idea that heritage is good for your well-being. So my journey, like quite a lot of people's probably, went from in the 1990s with the first sort of awareness that contact with heritage and archaeology could really make a difference to people's well-being. This was an ancient time team site that I won't talk about now, but in a very deprived area, and that transformative effect of just getting people involved and feeling positive about it. I then moved into sort of quite transactional heritage benefits, looking at building skills and raising aspirations through heritage participation. And then moved sort of from skills into community archaeology, and became increasingly aware of those sort of well-being impacts, not least through the feedback. And I'm sure we've all seen lots and lots of feedback like this, the sort of sense of buzz that you get from what people write down. And then in 2015, I moved to the University of Lincoln with a position that enabled me to focus much more on the sort of research side of things. And I was by then really very much looking at this question of the social impact, but wanting to broaden this out. So we did a project, for example, on a council estate with residents on that council estate in Gainsborough, which was one of the sort of bottom decile for multiple deprivation. And again, saw exactly those same buzzy responses about how much they'd enjoyed it. And then into sort of projects that were specifically run for the purpose of well-being, rather like Operation Nightingale, which we're going to hear from later on, Wings to the Past with RAF families in 2019. And then over the last 5 years, there's been a couple of research projects that I've been leading, which have been looking at this same aspect. And I'm going to talk about these a little bit in terms of how they worked and what they've told us and why that I think that is important. And this was very much informed by the sort of comments that we had even right back when we were doing the schools work, when we were really just trying to build their confidence and aspirations for education. But we got this, and this is a paper that was published years ago, 2014, and it's actually commenting on that sort of sense of buzz and how that made a difference to how the students, the pupils, these are 13, 14-year-olds we were working with, the difference that sense that they'd enjoyed it, they felt good, made to what they gained from it in terms of skills and aspirations for and ability to make those aspirations real because they got the skills. So obviously, since in the last few years, there have been a large number of reports. Linda's already alluded to one, looking at this question, the relationship between well-being and heritage. And I'm sure a lot of us are very familiar with all of these, but I just want to pick out a couple of quotes from them, which is really about the evidence base and the robustness of that evidence base that we have. So the What Works Centre, which has again just been mentioned, everything joins up so nicely. It says there's consistent evidence from qualitative, quantitative and mixed method studies that all of these historic places, assets, associated interventions have a wide range of beneficial impacts, etc., etc. But they also go on to comment that compared to studies which have involved randomized controlled trials, this gold standard, they say, of intervention study design, most of the evidence from the studies they looked at was of this, and it seems so condemning, doesn't it, low methodological quality. It makes point, these are my emphases, incidentally. This is common for evaluations of complex social interventions in community settings, and it goes on to explain why. But this same problem comes up again and again. So the Heritage Alliance report published in 2020 again talks about randomized controlled trials, RCTs, quantitative evidence using randomly select groups and a control group. Again, this term gold standard in the medical and scientific professions. And this, again, it makes the point the cultural sector uses smaller sample sizes, qualitative evidence, and meaning that this issue of credibility and impact can be harder to prove to the health sector and funding bodies. And that's the critical challenge that I think we're still facing in most places, and particularly at the moment when money is tight everywhere, is that if we're really going to expand out the availability of opportunities that we know are really good for people's well-being, if we're going to make those widely available, much more widely available, we have to be able to deliver really persuasive arguments and evidence to the health sector, the policymakers, the funding bodies. And that same, the 2019 report came up with a list of sort of requirements for better research, which are listed here around methodological design, more longitudinal research, larger numbers of participants, random selection, control comparator groups, investigation of adverse impacts, higher quality reporting. Sorry, I'm talking to one of the screens. I appreciate those of you on that side of the room might be feeling ignored. The screen's a bit small here and my eyes aren't quite up to reading the slides. Higher quality reporting, tackling gaps in coverage, and an explicit focus on the distribution of impacts, that's inequalities. And again, that's been mentioned already this morning. But I think it's in this context of better research that universities can step in. We can put together interdisciplinary teams with that expertise that needs to bridge heritage, medicine, health, economics, and so on, and also knows about research methods, trial design, data analysis, and interdisciplinary working, which is in itself a challenge. And we can also, if we're lucky, apply for the sort of funding needed to disinterestedly run these trials. If we're not actually running interventions ourselves, we don't have that interest in being able to prove they work. We merely want to see how they work to produce this sort of validated data, which has this credibility that we need. So there's a couple of recent studies that we've carried out, one looking at heritage at risk and volunteering, which was a qualitative study, and one which actually did qualitative and quantitative studies, but I'm going to talk about the quantitative one. I'm going to just talk very briefly about the first of these because I don't have very much time. This was, as I say, a qualitative study. We did we did 35 in-depth interviews with participants, volunteers on 10 projects across England. It was funded by Historic England and did a thematic analysis of this transcribed interview. So there was 185,000 words were what the transcribed data came to. So it was a big data set. And then we did a thematic analysis using a sort of grounded theory approach and elicited these 6 themes, which were apparent when we saw respondents' comments alluding to well-being or representing well-being, expressing well-being. So we literally looked where there were evidence of well-being in their context and looked for the associations with heritage. And I'm not going to go through these themes in detail because it's a whole separate lecture. But we have this sense of purpose, of being, of building capacity, of sharing, of self-nurture and self-actualization. And those of you who've had a minute to read through some of these bits and pieces will see some of these look very familiar. The interesting thing about this really was that the analysis, the thematic analysis, was done by colleagues of mine at the university who are not heritage professionals, they are health professionals. They're in our community and health research unit at the university. So they were not coming in from a heritage background, so they brought that different perspective to it. And we were also looked at what is the USP of heritage in this. So some of the things like sharing, connecting with others, you can do that through any sort of volunteering. So we looked into what seemed to be the themes in the relationship between heritage and particularly at-risk heritage, because it was the project was themed around at-risk heritage volunteering. And again, I'm not going to talk about this in detail, but you can see these themes starting to come out here, and they are in that report. And it gives us this sense of kind of why does it work? What is at work there? But the project I'm going to talk about just for a couple of minutes more is this other project, Community Archaeology in Rural Environments, Meeting Societal Challenges which we abbreviated to CARE MSOC, and generally gets referred to as the CARE project, which of course has a rather neat acronym and double meaning. This was a project funded by the EU in the Czech Republic, Netherlands, Poland, and the UK. And the aim of that was, first of all, to introduce the notion of participatory archaeology in those countries where it simply hadn't been practiced before. It's quite difficult legally in a lot of European countries for members of the public to get involved. So we were introducing it, but also wanting to look at the impact. We started it in 2019, turned out not to be a great year to start a big, large-scale community project. But everyone was carrying out the same activity, 1 metre square test pit excavation. So we were controlling some of the variables around what people were doing. So we knew that everyone on it had done the same thing. They were all working in their own communities. It was just referenced a minute ago to go to where people are. This is what we were doing. Just over 1,000 people took part in 17 different communities. We got feedback data of one sort or impact data, one sort or another from 30%. And we got the standard thing about people rating the experience and so on. We looked at the different aspects they'd enjoyed, learning something new and so on. And we could see the links between those and those key sort of pillars of well-being that, again, I'm sure we're all very familiar with. But what we did that was really novel was a quasi-experimental study on this with psychologists. So we had psychologists at the University of Exeter who designed this study and ran it. And this was actually looking for causality between in this impact, in these positive outcomes, that improved well-being. Could we trace the impact? So I appreciate I'm running through these slides quite quickly. But the key features of it, the survey was set up as a series of these questions with a 5-point Likert scale that were completed at 2 points, so before and after the activity. So we could see the difference in participants in all of these statements. And crucially, we also had a control group of people who hadn't taken part in the activity but lived in the same community. So we had our non-participant control group. 77 people took part in this survey altogether. As you can see, it was only run in the Netherlands and the UK in 2019. And again, I've got a whole series of these slides. I'm going to just look at one and then show you the whole lot. But what we ended up with was we had the data from Saturday morning, which is the start point, then the data from Sunday afternoon, which was the end point. The blue-green line is the dig participants, and the yellow line is the control group. So for each of these different aspects of how people feel, this is about their perceptions of social support, how supportive people feel their community is. We can see how both groups were at the beginning, and we can see the change. And you can see very clearly there's a significant impact on that blue-green dig participant line and really no change in the control group. We see the same thing in measures relating to life satisfaction. I'm not quite sure why the dig participants had lower life satisfaction at the beginning, and that in itself is quite interesting. But we can see, again, community identification, how closely people feel they belong in their community, place attachment, how appreciative people feel of the place they live in. And again, you can see you've got positive changes in the participant group, no change or no significant change in the control group. So for that reason, you can directly attribute the participation to the effect. Group continuity, sense of long-term connectedness, same. And then positive emotions as well. And if that sounds a bit vague, we did actually, we had data on all of these positive emotions, and we could see the positive emotions. There was an increase in the participant group and either a no change or decrease in the control group. And again, I'm not going to run through these because I really should stop in a minute. So I'm going to skip over these. The summary, and this was published in the Journal of Applied Social Psychology. I'm very proud to have a psychology paper published. But the comment in this, it did suggest that the TPE, test pit excavation participation, results in these changes in perception, and these are what are underpinning this sense of increased well-being. And it notes these changes were not observed in the control group, and they provide evidence for causal impact. This is in a peer-reviewed psychology journal. So why is this important? Well, it demonstrates that causal relationship because we have the change and we can compare it with the control group. This shows us that it works. Now, we in this room would all know it works, I think probably, or suspect it probably does, but we're not talking about evidence for believers. This is about the funders, the non-believers, the policymakers. It elicits the underpinning mechanism. So both of these projects have given us an idea about why it works. And it also shows, particularly the second study, shows that its quasi-experimental trial can be done. That notion of getting a control group included, which is difficult and expensive and has a lot of ethical issues around it, we can do that. It is complicated, expensive and difficult, but it can be done. And it does deliver useful results because this is what we need. This is this credibility and impact that we need to be able to prove to the health sector and funding bodies, as the Heritage Alliance commented. So how close are we to a tipping point? Well, I don't think we're there yet. I think the evidence we are building up, and again, all of us in this room, I'm sure, will be talking about projects that we've done, and everything builds together. But this sort of robust scientific quasi-experimental data, if you like, is necessary, but probably not yet sufficient, and especially today. The gaps we have really, longitudinal research, like 2019 was not a good year to start this. We were going to extend it into the Czech Republic and Poland in 2020. That, of course, didn't happen. But the time we were able really to think about doing it again in 2022, it was evident that the baseline data was going to have had changed in terms of well-being. So we'd either have to start again or just publish as was. And of course, by 2022, the Ukraine war had also started, which was significantly affecting Czech Republic and Poland very directly, and all of us in terms of sort of cost of living and so on. Larger numbers of participants. We didn't do a power analysis for this. We wanted to get as many as possible. We didn't get as many as we would have liked. And random selection. We didn't randomize people to participate because we were introducing participative archaeology. We didn't want a load of people to come forward and then have to turn half of them down and put them in a control group. And that's some of the ethical complexity around running these sorts of trials. What can we do to achieve a step change? Well, I think this will be something hopefully we'll all be talking about, in this conference and future. We need to fill those gaps. We need a larger, again, controlled trial that is longitudinal, powered with a power calculation. So we know that we've done enough study that will show we've got a big enough cohort that any effect would be visible. And we know how to do that. And in fact, Liz is in this room, has been very much involved in that. And randomized. We need to grasp the nettle of randomizing participation against non-participation in the same way that one would do with the drug trial, which is why I've had little bottles of pills showing in the slides here and there. We have to think about it like that. And it's not easy if you're here at Delapre Abbey and you want to get people involved and see how people are responding to that environment, because that's not the agenda. You don't want to be turning people away. But again, if you've got a research project, you can do that. And I think we need to disseminate our evidence. We need to do a Hearts and Minds campaign, move the public consciousness dial, really, in thinking the same way that people are quite increasingly aware. I think that green spaces are good for well-being. We want people to be increasingly aware that heritage space and activities are good for well-being in that same way. And we also need to work with people who might be our partners. And just to finish off, this was a survey that I did for a completely different reason among people in local rural communities about research into medieval settlements that they lived in. But one of the, so we were asking them, what are they currently doing? What would they like to do if they had the skills and resources? And there was a whole load of different things like documentary research and field walking and so on. But at the bottom, it's about capturing the impact. And you can see on the bottom lines that I've outlined in black there, the red and orange are, yes, we're doing this a lot, or we're doing it quite a lot, or we'd like to do it. And you can see in the left-hand one of those, very few groups are capturing that impact. But in the right-hand column, nearly all of the groups would like to do that. So we have hundreds, thousands probably of groups across the country who could get involved in this sort of very grassroots activity in local places near where local people are. And we are also networked into European networks. We have a strategy for public benefits of archaeology in the European Archaeological Association, so we could spread that out. So I'm going to stop there. I'm sorry, I did start slightly late, but I certainly haven't finished, not slightly late. that I think is where we are, and maybe where we want to try and get.